You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. Folks, as of today, 1,404,386 confirmed cases of COVID-19 in the United States. 276,000 people have recovered, but the death toll, folks, is now at 82,485. Dr. Anthony Fauci, who the Trump White House refused to let him testify before the House, went before the Senate today. He is self-quarantining because he came in contact with a couple of White House staffers who tested positive for coronavirus. And he made it perfectly clear, warning that states and cities face dire consequences if they open too quickly.
Dr. Fauci, you have warned of needless suffering and death if we push to reopen too soon. But the president has actually been sending the opposite message. I want to ask you today, what is the most important message you have for communities and states that are reopening, even as our public health experts make it clear it's too soon? Tell us what the consequences are.
Thank you very much for that question, Senator Murray. As I've said many times publicly, what we have worked out is a guideline framework of how to safely open America again. And there are several checkpoints in that, with a gateway first of showing, depending on the dynamics of an outbreak in a particular region, state, city, or area, that would really determine the speed and the pace with which one does re-enter or reopen. So my word has been, and I've been very consistent in this, that I get concerned if you have a situation where the dynamics of an outbreak in an area are such that you are not seeing that gradual over 14-day decrease that would allow you to go to phase one. And then if you pass the checkpoints of phase one, go to phase two and phase three. What I've expressed then and again is my concern that if some areas, cities, states, or what have you, jump over those various checkpoints and prematurely open up without having the capability of being able to respond effectively and efficiently, my concern is that we will start to see little spikes that might turn into outbreaks. So therefore, I have been being very clear in my message to try to the best extent possible to go by the guidelines, which have been very well thought out and very well delineated.
So if a community or a state or a region doesn't go by those guidelines and reopen, the consequences could be pretty dire, correct?
The consequences could be really serious, particularly, and this is something that I think we also should pay attention to, that states, even if they're doing it at an appropriate pace, which many of them are and will, namely a pace that's commensurate with the dynamics of the outbreak, that they have in place already the capability that when there will be cases, there is no doubt, even under the best of circumstances, when you pull back on mitigation, you will see some cases appear. It's the ability and the capability of responding to those cases with good identification, isolation, and contact tracing will determine whether you can continue to go forward as you try to reopen America.
Now, for some reason, Republicans are just completely insistent about opening our schools, putting our children in danger. Senator Rand Paul of Kentucky got into this exchange with Dr. Fauci, pretty much saying, why are we listening to you? Watch this.
Because in all likelihood is a good way of putting it, the vast majority of these people will have immunity. Instead of saying there is no evidence, you know, the WHO kind of fed into this by saying no evidence of immunity. And in reality, there's every evidence stacking up. And in fact, a lot of the different studies have shown that it is very unlikely that you get it again in the short term. With regard to going back to school, one thing that was left out of that discussion is mortality. I mean, shouldn't we at least be discussing what the mortality of children is? This is for Dr. Fauci as well. You know, the mortality between 0 and 18 in the New York data approaches 0. It's not going to be absolutely 0, but it almost approaches 0. Between 18 and 45, the mortality in New York was 10 out of 100,000. So really, we do need to be thinking about that. We need to observe with an open mind what went on in Sweden, where the kids kept going to school. The mortality per capita in Sweden is actually less than France, less than Italy, less than Spain, less than Belgium, less than the Netherlands, about the same as Switzerland. But basically, I don't think there's anybody arguing that what happened in Sweden is an unacceptable result. I think people are intrigued by it, and we should be. I don't think any of us are certain when we do all these modelings. There have been more people wrong with modeling than right. We're opening up a lot of economies around the U.S., and I hope that people who are predicting doom and gloom and saying, oh, we can't do this, there's going to be a surge, will admit that they were wrong if there isn't a surge, because I think that's what's going to happen. In rural states, we never really reached any sort of pandemic levels in Kentucky and other states. We have less deaths in Kentucky than we have in an average flu season. It's not to say this isn't deadly, but really outside of New England, we've had a relatively benign course for this virus nationwide. And I think the one-size-fits-all that we're going to have a national strategy and nobody's going to go to school is kind of ridiculous. We really ought to be doing it school district by school district, and the power needs to be dispersed because people make wrong predictions. And really the history of this, when we look back, will be of wrong prediction after wrong prediction after wrong prediction, starting with Ferguson in England. So I think we ought to have a little bit of humility in our belief that we know what's best for the economy. And as much as I respect you, Dr. Fauci, I don't think you're the end all. I don't think you're the one person that gets to make a decision. We can listen to your advice, but there are people on the other side saying there's not going to be a surge and that we can safely open the economy, and the facts will bear this out. But if we keep kids out of school for another year, what's going to happen is the poor and underprivileged kids who don't have a parent that's able to teach them at home are not going to learn for a full year. And I think we ought to look at the Swedish model, and we ought to look at letting our kids get back to school. I think it's a huge mistake if we don't open the schools in the fall. Thank you.
Mr. Chairman, can I respond to that even though there are only 32 seconds left?
Yes, and you might make it clear whether or not you suggested that we shouldn't go back to school in the fall.
Well, first of all, Senator Paul, thank you for your comments. I have never made myself out to be the end-all and only voice in this. I'm a scientist, a physician, and a public health official. I give advice according to the best scientific evidence. There are a number of other people who come into that and give advice that are more related to the things that you spoke about the need to get the country back open again and economically. I don't give advice about economic things. I don't give advice about anything other than public health. So I wanted to respond to that. The second thing is that you use the word we should be humble about what we don't know. And I think that falls under the fact that we don't know everything about this virus. And we really better be very careful, particularly when it comes to children, because the more and more we learn, we're seeing things about what this virus can do that we didn't see from the studies in China or in Europe. For example, right now, children presenting with COVID-19 who actually have a very strange inflammatory syndrome, very similar to Kawasaki's syndrome. I think we better be careful if we are not cavalier in thinking that children are completely immune to the deleterious effects. So again, you're right in the numbers that children in general do much, much better than adults and the elderly, and particularly those with underlying conditions. But I am very careful and hopefully humble in knowing that I don't know everything about this disease, and that's why I'm very reserved in making broad predictions. Thank you.
All right, folks, look, this is what happens when you have people, frankly, who are just utterly clueless, like Senator Rand Paul. Every single night, we've got some of the top black experts. You're not going to see them on cable news or broadcast news because you swear black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honoré, the nation's first black Surgeon General, Dr. Joycelyn Elders. John Hope Bryant, he is the founder of Operation Hope. Senator Kamala Harris of California, Dr. Sadrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner OMARI Hardick, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Abear, Patel Saul. Howard University student. Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, senior economist at the Center for American Progress. Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward. Dr. Oliver Brooks is president of the National Medical Association, president of the American Medical Association. Dr. Patrice Harris. Joby Benjamin, Dr. Alexia Gaffney, infectious disease specialist. Dr. Georges Benjamin, executive director of the American Public Health Association. Malcolm Nance, family medicine physician. Dr. Jen Caudle. Dr. TSHAKA Cunningham, a molecular biologist at Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University. Congresswoman Yvette Clarke from the state of New York. William Spriggs, AFL-CIO economist. Andrea James, executive director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie British Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Brayboy, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she is a virologist. Principal Steve Perry of Capitol Prep. Health and wellness specialist Dr. Yolandra Hancock. Desmond Meade, president of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriot with The Root. Mina McWhorter, founder of Love by the Hand. Dr. Julianne Malveaux, economist, president, Emerita Bennett College. Coroner Michael Fowler is the mayor of Atlanta. KEISHA Lance Bottoms, mental health therapist Suzette Clark. Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr. Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District. Dr. Leon McDougall, president-elect of the National Medical Association. Jana Bailey, mayor of Moss Point, Mississippi. Mario King. We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You're getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com.